Pelvic exams may not be needed. Many women dread the indignity of the annual pelvic exam, in which they are poked and prodded with their feet in stirrups. Now an influential government task force says there isn't evidence that routine pelvic exams are necessary or prolong a woman's life. Some experts think they may even do more harm than good. And although some 60 million pelvic exams are done each year, the practice hasn't been studied much. The United States Preventive Services Task Force, a panel of experts in preventative and primary care, declared today that the current evidence is insufficient to assess the balance of benefits and harms of the pelvic exam. The task force performed an exhaustive search of the medical literature published over the past 60 years and located only 8 studies looking at the diagnostic accuracy of pelvic exams for just 4 medical conditions. "We can't make a recommendation one way or the other at this time," said Dr. Maureen Phipps, the chairwoman of obstetrics and gynecology at Brown University's Warren Alpert Medical School and a member of the task force. "We need more evidence." The finding refers only to the practice of routine pelvic exams for healthy women, and does not apply to women who are pregnant or those with existing conditions or symptoms that need to be evaluated. "This is not a recommendation against doing the exam," Dr. Phipps emphasized. "This is a recommendation to call for more research to figure out the benefits and harms associated with screening pelvic exams. That's the big message here." The recommendation is open to public comments through July 25. This is the first time the Preventive Services Task Force has turned its attention to pelvic examinations, which can include a visual exam of external genitalia, an internal exam using a speculum, manual palpation to check the shape and size of the uterus, ovaries and fallopian tubes, and the simultaneous palpation of the rectum and vagina using lubricated gloves. The recommendations about pelvic exams do not change current guidelines for cervical cancer screening, in which cells are collected from the surface of the cervix and vagina. The screening test is recommended every 3 years for women ages 21 to 29 and every 5 years for ages 30 to 65. Pelvic exams have been subjected to quite a bit of scrutiny in recent years, possibly because of turf battles between physicians and reimbursement battles with insurers. The exams can be both time-consuming and expensive, in part because doctors are advised to have a chaperone present during the exam.